Good afternoon, everyone joining us. This is our monthly lecture for Raphal Medical Centre. This afternoon, we are looking at COVID-19 and school reopening. What should parents and teachers know? And how can kids follow COVID-19 protocols? These monthly lectures basically are aimed at we creating awareness on health issues and also helping our clients make informed decisions on their health. To help us do this discussion this afternoon, we are privileged to have Dr. John B.K. Yabani. At this point, I'll give a brief profile of our resource person. Dr. John B.K. Yabani was born on the 15th of December, 1959. He is a public health physician specialist. He graduated from Rostov State Medical Institute in June 1983. He worked in Kolebu Teaching, Konfanoti Teaching Hospital and Mampong Ashanti Government Hospital.
Yes.
From 1988 to 1995. He graduated from the School of Public Health, University of Ghana, Legon in June 1996 with master's degree in public health. From 1996 to 2004, he was posted as District Director of Health Service to Dangwe East. From 2004 to 2012, he was posted to Accra Metropolis as Director of Health Services. Then from 2012 to 2019, he was the Tema Metropolitan Director of Health Services. And this was a position he held until his retirement in 2019. He is married with 6 children. I must say this topic is very important for us today, because as we all know, COVID-19 is still around and currently the cases are on the rise. Actually, the second phase has actually given us more severe impact, as most of us would attest, than even the first phase of the symptom. As we speak now, we are a little over 6,000 active cases. And our confirmed cases stands a little over 70,000 with over 400 mortalities. So we all need to glean from this all-important conversation and take some lessons to help us save our children, and also as educators know what to do in our institutions. So Dr. Yabani, I hand the platform over to you to carry on with the discussion. Thank you.
Thank you very much, Dr. Isaac Eshen. I am very happy. I am very happy to be with you. I want to say good afternoon to all of you.
Good afternoon.
Good afternoon.
Good afternoon to all of you. I can't hear all of you.
Good afternoon.
Good afternoon, doctor.
Okay.
Good afternoon.
Today, we are discussing a very, very important topic about schools and COVID-19. And for that matter, we want to discuss how we can handle issues as parents and teachers, that we will all be on the same level, understanding each other, because we can't fight COVID-19 together if we are all moving in different directions. And so today we are going to reason together, and at the end of the program, I believe that we will all take home lessons that will help us to cooperate with each other in our fight to defeat COVID-19. As I'm sharing with you, my presentation outline will give you a background, what is COVID-19, what parents should know, how we can get the kids to follow the COVID-19 safety protocols, and then a summary, and then we'll go into question time. Like Dr. Eshen said, coronavirus 2019 is caused by the severe acute respiratory syndrome coronavirus 2 and newly emerging coronavirus. It was first recognized in Wuhan, Hubei province in China in 2019. It is contagious to human beings, and it actually succeeded SARS-CoV coronavirus 1. In Ghana, the first case was reported on the 12th of March, 2020. And as at 1st February 2021, Ghana had recorded 696 cases of COVID-19, bringing the total active cases to 6,086. Cumulatively, the total number of confirmed infections is 69,255, with 440 deaths. And what I also want to say is that coronavirus is no respecter of persons. Like we have seen for the past few days or few months, coronavirus has destroyed a lot of our valuable human resource. And we cannot wait to lose such human resources. When you look at the map of Ghana, you can see where the active cases are, and you also can see the cumulative. I want to share with you the cumulative cases in COVID-19 as at 1st February 2021. You can see that the Greater Accra region is hard hit, followed by Ashanti, and the others are following. And this is a cause for concern for the whole country. The incubation period for COVID-19, that is the time between exposure of the virus and the onset of symptoms, is about 14 days, with an average of 5 to 7 days. During the period, that's the pre-symptomatic period, some infected persons can be contagious, especially for 1 to 3 days before symptoms onset. And this is very, very, very important for us. 1 to 3 days before symptoms onset, infected persons can be contagious. So it means that we need to take seriously our preventive packages that we have with us so that we will not be infected. And during this period, the virus is spread through droplets by direct or indirect contact with bodily fluids from an infected person. Transmission is mainly from both symptomatic and asymptomatic people. And this is through close contact through respiratory droplets, direct contact with infected people, contact with contaminated objects or surfaces, aerosols which are created in enclosed places indoors, and then crowded and inadequately ventilated spaces where infected persons spend a long period of time with others. For instance, the restaurants, classes, especially keep fit classes, the nightclubs, and then the offices, and then places of worship. An asymptomatic person, by definition, is a person infected with COVID-19 who does not develop symptoms, but are shedding the virus. Let us take note of that. And the symptomatic patients are those who are shedding the virus. And here, we want to emphasize the fact that the duration of virus shedding is estimated at the first 8 days from the onset of symptoms. These are all by way of information. The proportion of patients who become infected by remaining asymptomatic remains to be better understood. And it ranges up to 31%. And from various studies, contacts, for instance, the proportion of about between 8 and 50% remain asymptomatic, even though they are positive. 59% of obstetric patients are also asymptomatic. And 54% of workers in the nursing homes are also asymptomatic. And this is a cause for worry. I want to share with you the surveillance case definition for COVID-19. A suspected case is someone who has fever and symptoms of lower respiratory tract illness. For example, cough, difficulty in breathing, and in the last 14 days before onset of symptoms, a history of travel from any of the affected countries. Or fever, 38 degrees, and symptoms of lower respiratory tract illness. For example, cough, difficulty in breathing, and in the last 14 days before symptoms onset, close contact with the person who is under investigation for COVID-19 while that person was ill. So if any case falls into this framework, we are supposed to suspect. What are the clinical symptoms of COVID-19? For about 83 to 99%, there's fever, cough, fatigue, anoxia, shortness of breath, and myalgia. And there are also non-specific symptoms. And those symptoms include sore throat, nasal congestion, headache, diarrhea, nausea and vomiting, loss of smell, anosmia, and then loss of taste. So it tells us that there are a lot more symptoms which can appear without us actually suspecting. Most of the people with COVID-19, about 40% would develop mild disease, 40% moderate disease, 15% will develop severe disease, which requires oxygen support. 5% will develop a critical disease with complications, leading to respiratory failure, acute respiratory distress syndrome, sepsis and septic shock, thromboembolism leading to multiple organ failure, acute kidney injury, and then cardiac injury. Ladies and gentlemen, old age, smoking, underlying non-communicable diseases are comorbidities of this, which complicates the coronavirus disease. So for risk factors, ladies and gentlemen, people above 60 years are at risk. Underlying non-communicable diseases like diabetes, hypertension, cardiac disease, lung disease, cerebrovascular diseases, mental disorders are all, and immunosuppression are all risk factors. In pregnancy, increasing maternal, very high BMI, those who are obese, gestational diabetes, preeclampsia is also considered as a risk factor, and then smoking. So ladies and gentlemen, there are normal COVID-19 safety protocols which have been proposed, and we are following them. We are supposed to follow them religiously. We have the normal COVID-19 protocols I want to propose. The first one is about the wearing of the face mask. Social distancing, the minimum of 1 meter in between us. No handshakes, regular washing of hands with soap, alcohol-based sanitizing of hands, avoidance of what? Crowded rooms and crowded places. No touching of face, no mask, no entry into offices or public places, and then self-isolate if tested positive or awaiting results of tests. So these are the normal COVID-19 safety protocols which are proposed. I want to show some few slides about how masks should be worn, the correct way and then the wrong way. If you are looking at me on your right, where it is marked green, it means that it is the good way. And so the nose mask is supposed to cover the nose and the mouth. The nose mask is not supposed to cover the chin. So on the left and then on the right, you see the lady has also worn the mask properly on my left. And then you can see that she's only covered the mouth with it and the nose is exposed. The reason why we ask people to cover the nose and the mouth and the face is that it prevents you from touching the face, and then it prevents the droplets as somebody gets nearer to you from falling into your face and also into your eyes and also into your nose, inhaled into your nose. So the mask protects us so much. And for that matter, we don't want you to leave your guards down, but mask should cover the nose and the mouth. Let us look at the next one. When we talk about social distancing, it is very important. The distance should be a minimum of 1 meter or more. So do not let your guards down. Just the left picture, as I sit, gives the wrong way of interacting. The right one gives us the right picture of how we should space ourselves whilst we are speaking. Then when we are sitting, for the left picture, we need to do it right. The social distancing should be done right. If you stretch your hand and your hand touches the chest of your other friend, it means that you are not doing it right. If you sit and your hands are not touching each other when they are stretched, it means that you are obeying the social distancing. Then the picture on the right, tells us how protected we are. People think that the wearing of the face shield alone is protective. The wearing of the face shield is only supposed to do what? Protect you, the droplets, from entering your eyes and also falling on your face. But you can still inhale the droplets. So it is advised that the wearing of the face mask should go with what? The face shield. That makes it more protective. So we do not want us to put on the face shield and be happy that we have protected ourselves. It is when you have added the mask that you are completely protected. Then handshaking. In our culture, we love handshaking, but we realize that the hands are the ones that carry the germs into our system. And for that matter, we are pleading that the handshaking must stop, and it is the wrong way of preventing COVID-19. And if we still want to communicate, the down there tells us how we can communicate by using our elbows to touch each other, and we'll be happy. So no shaking of hands, but you can elbow one another in order to greet. Then the picture on the right tells us that we can still speak through the mic. We can still speak through to other people, to their hearing, not necessarily drawing down our masks to speak. We need to sanitize our hands before putting and before removing our face masks. And then more regularly, mop the floor of your homes. We are talking about what the parents and the teachers must know. Mop the floor of your home and office, depending on the traffic to your office and to your home. Depending on how risky your outing is, upon return, without touching anything or interacting with anyone, go straight to the washroom and then wash down. All attire for outing should immediately be removed and confined to a place outside your sitting or your bedroom. And do not allow your children to carry those things, otherwise they will be put at risk. All items also bought from the markets, shopping malls, should first be confined outside and be treated with soap, sanitizer, or heat, depending on what is most convenient. Brush or wipe all surfaces of seats, table at home and offices regularly with either bleach or hand sanitizer, and depending on what, the inflow of the human traffic. Sanitize or treat with soap everything you touched upon returning home, including the hand sanitizer bottle itself, your car keys, your car door handles, and then your handkerchiefs, and then your house door handles. Please, when you are even entering your vehicle and you open your door and you sit down, sanitize your hands before you move, because you will never know who came to touch your door handle before you came to open it. The following guidelines may also be helpful to the family. If possible, avoid the repeat wearing of the same clothes the following day, unless it is washed or submerged in hot water. Build your immune system with a balanced diet. Very, very, very important. Upping your vitamin C, upping with vitamin C, and then zinc. Vitamin C, D, and zinc. At least once a day, inhale steam with towel over your head for about 5 to 10 minutes. First, inhale through the nose and exhale through the mouth severally, and then do the reverse. When the virus enters your nostrils, it multiplies in there and continues to move down through the throat. And so when you do the heat inhalation, it kills them because they die at about 60 degrees Celsius. And so it is invisible, monstrous, and as it sweeps across the globe, your daily survival may not be secure, but we know that when you die, you should be assured of your eternity. But I know by the grace of God, We will follow all the physical protocol and also the package that has been given to us. What should parents and teachers know? The primary objective of COVID-19 response is to slow and stop transmission. Therefore, we are supposed to find, isolate, test every suspected case, and provide timely and appropriate care of our children, especially during this time. So it means that we are not working alone. We need to work with the health authorities, the education authorities, understanding each other so that when there is an outbreak, we can cooperate with each other so that we find a solution to it. So in the school environment, there is triaging. When the child comes to school, they are supposed to be seen, temperature taken, questions asked, and so on and so forth. And if the child falls within the suspected case definition, then the child will have to be isolated and tested. And all this can be done when you have contacted the health authorities who will respond to your call and come and collect the specimen. It can be recommended that the location of care will depend on what? The arrangements with the health authorities. Because there are facilities available where patients can be taken to be tested and also for treatment. It is recommended that screening of all children at first contact with the school system in order to identify those who are suspected of COVID-19. Mothers, parents, and teachers, you're supposed to be maintaining physical minimum of 1 meter from other individuals, performing hand hygiene frequently with an alcohol hand rub if available, and if hands are not visibly dirty. But when the hands are visibly dirty, you need to wash with soap under running water. Avoid touching your eyes, your nose, and your mouth. Don't touch your face with your dirty hands because you will never know where you have touched. You will never know whether you have picked a virus on any surface, whether it is the door handle, whether it is the door handle of your car, and so on and so forth. So that when we do all this, we will be protecting our children also from getting the disease. We should also practice respiratory hygiene by coughing and sneezing into our bent elbow, like I'm doing. Cough, when you cough into your bent elbow, the corner there, so that you don't cough into your hands. You use a tissue and you immediately dispose it and sanitize your hands. Wearing of a medical mask if you have respiratory symptoms, and performing hand hygiene after disposing of the mask. Please, it is very important to wear the mask all the time so that we will not get ourselves infected. And the mask alone is not what will protect you. It is the other protocols that will help us, including the washing of hands, maintaining physical distancing, and staying at home when it is necessary. So in the school environment, it is very important also to train the cleaners to be alert and clean all the surfaces that can be touched by the children in the school. So for the reopening of the schools, we know that the management of the schools are planning and they want to get ready for the schools as they prepare to reopen. I know some of the schools have reopened, and some of them are also expecting students to come, I think, in March. And for a school to reopen, we need to disinfect all the schools. And I believe that one has been done for all the schools. Provision of what? Equipment for infection prevention and control. We have the Veronica buckets, soaps, hand sanitizers, paper tissues, all those ones should be made available. Provision of washable and reusable masks for all students and staff. School should not be available to outside activities. It means that we should, as much as possible, not allow mass gathering in the schools in the form of sporting activities and so on and so forth. The school COVID-19 committees should be in place and working. And then the schools should be mapped to health facilities, especially if they have no sick bays. All these ones we need to plan by the school committees and then provide a preparedness plan and then a response strategy. So every school should have a preparedness plan and a response strategy so that when there is suspicion, they will not be found wanting. They know who to contact, what to do, how to isolate the child, and so on and so forth. And isolating and preparing all the isolation centers in the hospital or the holding centers in the hospital in good shape so that they can keep the person there whilst they wait for the health authorities to come and assist them. Every school must make sure that it is mapped to a health facility. And the information about those health facilities should be made known to parents so that they will know that if anything happens, this is where I should send my child if the need arises. If anything happens, this is where the authorities will send the child should anything happen. And then we need to assess our preparedness all the time. It should be a continuous activity, monitoring the activities in the school, evaluating them, and then putting the right works in place. And there's supposed to be what? Daily updates on school situation. That's the children who are visiting the sick bay, those who are coming with complaints, they should be examined, and then a report, daily report, written by and sent to the head of the school, who will then disseminate it to the authorities, both above and below. So in preparedness, I just want to give you a definition about what preparedness means. It is the knowledge capacities and organizational systems developed by government's response and recovery organizations and communities and individuals to effectively anticipate, respond, and to recover from impacts of likely imminent, emerging, or current emergencies. So we need to put our heads together, knowledge together, so that it can help the systems to respond very well, and we can also anticipate what is going to happen, depending. So it means when we are preparing, we need to bring people from various areas to come and help us in our preparation, so that they tell us what is prevailing and how we can use that knowledge to come out with what? A plan. It is an integral part of the health system strengthening and crucial health emergency disaster risk management. Therefore, inadequate infection prevention and control measures may lead to what? Transmission of diseases to children, staff, visitors, and within the community. So it is very important for us to prepare and then be ready. And when we talk about readiness, we are talking about the capacities in the systems that should be in place. When we say the school is ready, it means they have their response plan in place. They have their infection prevention and control measures in place. And they have all their collaborators, they have their directory and everything in place, so that if there is a health emergency, they can be ready to aggressively contain the event before it further spreads. So there's a need to be very, very ready in all these things. Then infection prevention and control. It is the basic requirement for an outbreak preparedness and a critical element for preparedness. It is a scientific approach with practical solutions designed to prevent harm caused by infections to patients and, for that matter, children and health workers. It is grounded on infectious diseases, social science, epidemiology, and the health system strengthening, as well as the safety of patients, for this matter, our children, and then the health services. These are the levels we deal with when it comes to education. We have the creches, the kindergartens, the primary schools, junior high schools, senior high schools, and the tertiary institutions. Parents and teachers will agree with me that these are challenging areas, especially the creches and then the kindergartens, where we have to make, and the primary schools, where we have to make decisions that will help our children to be safe, especially at this time when we have COVID-19. And therefore, parents will have to work together with teachers. Parents will have to take certain decisions, especially, I want to give an example. If you are taking your child to the creche, you must go and observe what happens at the creche. If the creche is overcrowded, then you don't have to send your child there. Find another place so that you don't expose your child. Because where there is crowd, where the children are so many in the creche, your child will not be safe. And so all these decisions have to be taken by parents. Then, how can we get the kids to follow the COVID-19 protocols? Teachers and parents play a very important role here. You agree with me that children learn by observing their parents and their teachers. And therefore, we need to set very good examples for our children at home and also at school. A mother who has a parent or parents who have not learned to wear a face mask and wash their hands all the time, it becomes difficult for the children to do it. So the children need to be taught how to start wearing their face mask long before school reopens, so that they will be comfortable with it when they go to school. And we also need to teach them how to wear the mask, sanitize their hands before wearing the mask, and then before removing. So it means that we need to put even hand sanitizers in their school bags and teach them how to use the hand sanitizers before they wear their masks and before they remove it. Children should also know that we don't share face masks. Children should know that we don't share face masks. So when you put a blue face mask on your child and he comes home with a black one, you should be worried. You should be worried. Did the school provide that mask, or he took it from a friend and wore it? If that one happens, it is a way of transmitting infection, should there be one. How will they keep their mask? We must teach them how to keep their mask clean when they are eating. It is possible for us to teach them to put their mask back into a rubber whilst they are eating, so that when they finish, they can sanitize their hands and put it back. They must be taught that wearing of the mask under the chin is not good. Wearing of the mask under the chin is not good. So it means that adults will have to stop wearing the masks under their chin so that the children will not learn from them. We should also, as much as possible, provide masks and hand sanitizers in their school bags. That one is a must for parents. Make sure you have extra face mask for your child when he's going to school, because the one that is putting on can be soiled any time. And so we need to put extra ones in there. And we need also to pick our children early from school to minimize contact with others. When the children close and daddy or mommy is not there to pick them, they will just be moving around playing with others. And when that one happens, they are not obeying the social distancing. They are exchanging materials, shaking each other, wrestling with each other, and so on and so forth. And that one could be disastrous. Teachers, we are supposed to reinforce what the child has learned at home. And I want to say here that teachers should wear their mask and wear them well, so that when they will have the confidence. We know our teachers, they have the confidence to teach, and they are the ones, at least, who have helped us to come this far. Thank you. It should be the first thing before classes start and the last thing before classes end, which means the teacher should be able to explain to the children how masks are worn and how we can apply some of the COVID-19 protocols, the first thing before classes start and the last thing. And we also ask the teachers to engage the children in exercises, either in drawing somebody who is well masked and so on. When the child draws somebody who is masked with his mask under the nose, it means that the child is not understanding what is happening. And then how to wash your hands and also how to use the hand sanitizer. It will depend on the teachers to reinforce these ones when the child comes to school. In summary, COVID-19 is one of the dreadful diseases in recent times. It is no respecter of persons, and parents have to support the teachers to manage the children, especially those in the creche and the primary schools and the kindergartens. The COVID-19 protocol for prevention is available, and it is the true way to prevent the pandemic, since vaccines have not yet arrived. Teachers and parents need to work together to give understanding to the children to follow the COVID-19 protocols. We need to be each other's keeper. We need to be each other's keeper, because it is when you are observing me, when I miss one of the protocols, you remind me that I have missed it and that I should take note of it. I shouldn't be angry with you. I should take it in good faith, because we can easily forget and skip some of the COVID-19 protocols. And that one can cause us to do what? To get the disease. And the disease, we need to fight it together with the right attitude. We are not in normal times. And for that matter, we don't have to be behaving the same way we were behaving a year ago. We need to get our acts together and be vigilant on each other, especially our children, giving them the necessary guidance for us to save them from this dreadful disease. I want to thank you, and I'll be ready for questions and to answer. Thank you very much.
All right, Dr. Yabani. Thank you so much for the presentation. Please, can you all hear me?
Yes, we can hear you.
We can hear you.
Yes, thank you. So at this point, we are open to questions. Dr. Yabani is available to get our questions and provide us with clarity. But before we get, yes, somebody is asking if there's Dr. Shen. There's Dr. Shen, please. Before we get to the question, he has given us a lot of information to actually take home and apply in our aim to prevent the COVID-19 transmission. Now, he made a very important statement. He said the mask alone cannot protect us. And I'm mentioning this because now it's becoming a problem, even with the mask wearing. We see adults coming in with their mask either below their nose, and some not even wearing it at all. Now, he mentioned that it's the implementation of the several coordinated interventions that can help reduce the risk. So COVID-19 is real, and those of us in the health sector, and I'm sure some of us whom have had relatives suffer this ill fate, we've come to terms of the reality. So we need to actually strengthen the protocols, observing the protocols, and making sure we are teaching our kids. So we are open to questions. We are looking at what should teachers know and how can the kids also follow the protocols. Somebody has a question. John Agbe says that are students with disabilities required to wear face coverings in school buildings and school buses? So there's a question from John Agbe asking, are students with disabilities requiring to wear face masks or face coverings in school buildings and school buses? But if Agbe, if you are listening to me, if you could clarify which form of disability, because students with special needs could vary with those with sight. Please, if you're on the platform, we'll kindly indulge you to mute your microphones. And if you have a question, you can send it via the chat section, and I'll do well to read it to the listening of the resource personnel. So I was asking Agbe if you could clarify your students with disability. And his question is, are students with disabilities required to wear face masks in school buildings and school buses? So Dr. Yabani.
Yes, yes. Like you rightly asked, which form of disability? And another question is that, are they going to be alone in those buses or the school buildings? Once they are not going to be alone in the school buildings, they will have to wear face masks and they will have to be guided, you understand? But they don't need to wear the face mask and things to sleep, okay? So they are supposed to wear face masks. If they are able to remove it, if they are able, if they have hands and so on. So unless, of course, the person cannot attend to himself. So there are different forms of disabilities, and the management of those institutions will have to put measures in place to protect them. If they cannot, then there should be another way of handling them. I think they should put on face masks because that one will protect them as well, because they are also vulnerable. But those who cannot also, who are visually impaired, normally they move with what? Aids. They move with people, and those people can also assist them. So they need assistance to put on masks because they may not be alone at where they find themselves. But if they are at home, you can remove the masks because you are at home. But once you come out of your home, the mask should be on. Otherwise, you are putting yourself at risk and you are putting the other people, your other friends, also at risk. So they are supposed to put on face masks, but they should be observed closely so that they don't get suffocated. That is my opinion. I saw a question asking whether the disposable mask can be ironed, washed and ironed. No, the disposable mask is supposed to be used once. And after that, it should be discarded. It's supposed to be used once, and after that be discarded.
And I was even adding that there are some few exemptions that I think I've seen from the American Academy of Pediatricians that they have also added for the mask exemptions. Aside children with disability, they are also advocating that children who are under the age of 2 may have a little issue. So those are also one. Then they also advocated for individuals with breathing difficulties. So if you are a person with some underlying condition that impacts some breathing difficulty, that also may confer some exemption. Then those who are incapacitated and don't have assistance. So people who cannot by themselves remove the marks, sometimes, it also becomes a challenge. Then there are also exemptions for teachers. Teachers who are teaching deaf or hard to hear people. So this one I'm thinking maybe because they have to read their lip movements. So these tutors are also in a way given exemption. Then people who are receiving speech or language therapy. So these people are also, that's the tutors or educators providing these kind of services may in a way be exempted. But as we have communicated this afternoon, I mean, for this to be possible, then the other bits that has to do with the social distancing has to be enforced. Then I also got your answer on the ironing. Now there's a question from Lilia. She is saying, if we are outdoors or well-ventilated places, can we remove the masks to breathe fresh air small? So
exactly.
Basically,
it is possible that when you are feeling heavy and you want to breathe, you go to a place which is well ventilated, and then you remove your mask and breathe very well before you come in to join the other people. So it is possible to do that one. Yes. You cannot put on your mask for more than 8 hours. You can't do that. So you can make your way out of where we have the crowd, go to a far place, and then do what? Breathe the fresh air, especially if you have, you are in a place where you can get the fresh air to breathe. So it is possible to do that.
All right, thank you. There is also another question here from Emmanuel Aqua, and he is saying he's a primary school teacher, and he's asking, how can I maintain physical distancing with my learners while supervising their work on a daily basis? So he's a primary school teacher and asking, how can he ensure physical distancing among his students?
Like I was saying, the prevention, the COVID-19 protocol is a package. When you find yourself in a position not to be able to follow one, the others should help you to protect yourself. So if you are in a mask, and you have your hand sanitizer and all those things, you should be able to handle your children. You are in a mask, the children also are in masks, and so they should be able to protect you depending on the situation, especially in the primary school and then the kindergartens, where the children are very, very mobile.
Okay, we also have another question from Sets or Secri. Says, please okay, somebody, let me go to this one. It says, is it advisable that children below 6 years should not wear the nose masks? And what would you advise a class size of 20 and more with children? And so basically asking, are children under 6 not supposed to wear the nose masks? And what would be your advice for maybe tutors who are handling class size of 20 and more?
Yeah, a class size of 20 or more depends on the space that you have in hand. If you're able to maintain the physical distancing between the class, that's the sitting arrangement, then you can. Otherwise, there should be, management should try and do a shift system, or we don't spend too much time in the class. Teach the salient things and then dismiss the children. That is what I have. But for children under 6 years, they learn from their parents. And if they want to put on the mask, let's allow them to learn from the beginning, so that when they grow, they will get used to it.
Okay, so I think basically as I mentioned earlier, even for the American Academy of Pediatricians, those at age 2, they are supposed to wear the masks. It's only for those under age 2. So I think those under above 2, that's from 3, even from 2 up onwards, they should all do wear the masks.
Yes.
And for the class size of 20, I think, as doctor has already mentioned, I mean, the structure is also important.
Yeah.
Because, if the building is such that, I mean, the distancing cannot allow for that 1 meter or 6 feet seating arrangements, then obviously it cannot contain the number 20. So I think there's a question here from Magdalene Kofi saying, what are the basic requirements a school's sick bay must have? So a sick bay basic requirement for the prevention of COVID-19.
A sick bay basic requirements. They must have a nurse. They must have a nurse, and they must have a temperature gun, and they must have, if possible, masks and so on. But they must have a nurse who will observe the children and then advise them as much as possible, so that those who need help, they can quickly contact the health authorities to come and help them. So for COVID-19, you need a temperature gun, you need your tools to collect your data, and also you need educational materials, either audiovisuals and so on, so that you can educate the children. Unless, of course, there are other diseases which comorbid what do you call it, the COVID-19. Because for the basic sick bay, there are guidelines, and those guidelines have been forwarded to schools, and most of the senior high schools, they have sick bays. And those who do not have sick bays, they are making attempts to build one. But for the meantime, they have been mapped to health facilities who will respond to their call. So the equipment needed, the human resource needed are all there, and the school authorities, they know that one. But what they need for all those ones to function is a trained nurse.
Okay. All right. Thank you, Dr. Yabani. There is a question from Godfred Amano. He's asking, please, in the absence of COVID-19 team, if a person is showing signs of COVID-19, how do we help out? And Doc, can you please demonstrate the proper way of wearing the mask? So the question is actually 2 in 1. That in the absence of a COVID-19 medical team, if somebody is showing signs of COVID-19, how can maybe the school authorities help? And can you demonstrate the wearing of the face masks?
Okay. For this time, a COVID-19 team in every school is mandatory. It's mandatory. And their business is to ensure that there is smooth running of what? People observing the protocols the various equipment are in place and they are being correctly used. Yeah, you get it. So for if we can't say actually that there is no COVID-19 team, there should be a COVID-19 team in every school. And that COVID-19 team should prepare a directory and share it with teachers and so on, so that when there is any difficulty, they will be called upon. A directory is the one which contains the numbers of very important people, the chairman of the COVID-19 team, the medical team, their head, the nurse on duty, and so on and so forth. So if the school has that directory, it means that they can communicate easily for help. So every school is supposed to have a COVID-19 team, and they must work together with the school nurse and then report to the head of the school. Then to demonstrate how to wear a mask. When you buy your mask, when you buy a mask, it is in a rubber. Before you remove the rubber, before you remove the mask, you need to sanitize your hands. You sanitize your hands, and then you remove the mask, the rubber. And when you remove the mask from the rubber, I don't have a mask here and I don't want to remove my mask. So what you can do is, when you take the mask, you don't touch, you only pick it by the strands holding it. And then the blue part is supposed to be out and the white part in. You place it on your nose and then you put it behind your ears, and then you use your clean hands to fit it. There is a wire in there so that it can fit on the bridge of the nose. And you make sure that you don't touch the mask. So the mask should be able to fit you very well. If it doesn't fit and it is hanging, it may not be protecting you. And the same applies to when you want to remove the mask. When you want to remove the mask, you sanitize your hands, you hold the strand, remove it with your head forward, and then when you remove it, my glasses is obstructing me. When you remove it, you don't touch the front, you just drop it into the dustbin, and that is all. But if it is a reusable mask, you do what? You wash it in hot water and then dry it. And when it is dried, you iron it and keep it for the next use. So it is about, then when you finish, you sanitize your hands. So it is very important to sanitize your hands before touching your mask. And anytime you want to touch your mask, don't touch it at the front. Sanitize. When you touch it even, you have to sanitize your hands so that you may not have to pick any droplets which has fallen on it. And then when you remove the mask, wash your hands. Do not pick your nose or put your hands in your eyes, and so on and so forth.
All right, thank you, Doc. There is another question from Jemima Latte. It says, can vitamin C 1,000 milligram with zinc be given to children under 5? And the second question is it okay for children to engage in extracurricular activities like swimming and piano lessons whilst at school? So the first bit is asking whether the 1,000 milligram vitamin C with zinc is appropriate for children under 5. And should children engage in extracurricular activities?
I think vitamin C does not only come in 1,000 milligrams.
Yes, Doc.
I think we have 100 milligrams and so on. Those ones can be given to kids to suck.
Yeah.
Yes. So, and of course, vitamin C, when it enters the body and the body doesn't need it, you urinate it and it comes out. All right. And the good thing about vitamin C is it boosts the immune system. After it has been digested and so on, it produces an alkaline medium which boosts the alkalinity of the blood, and for that matter, boosts the immune system. So I will say that, yes, vitamin C can be given to a child, but not at that high dose. Can do it in doses of, or when you melt it in the water, you can give it in bits. And I don't think it will affect the child, okay? And then extracurricular activities. Extracurricular activities. The problem is about crowding. If there's no crowding and there is social distancing, that is okay. But when the person is undertaking heavy strenuous activity, it is difficult for them to comply with the wearing of masks and so on. So it is normally, it makes breathability difficult. And some of them want to remove it so that they can catch more air. But for any activity which will breach social distancing, it is not advisable, especially at the peak when we have cases increasing and so on and so forth. If I got the question right, that is my answer to it.
Yes, Doc. And I will also add, for these activities, then the school should even have an outdoor space. Because for schools that don't have an outdoor space, these extracurricular activities, I think, should best be avoided.
Yes.
We move to another question from Nana Sechi. He is asking, Doc, what's your opinion on air conditioners and the spread of the virus? And what precautions can be taken in enclosed places that only get ventilated by air conditioners?
Then, as for air conditioning, what does it do? It circulates air which is in the room, isn't it? It circulates air which is in the room. So it is not advisable to close the whole place and have an air conditioner in there. The protocol is telling us that the place should be well ventilated. So it means that there should be re-engineering of a premise at this time. And therefore, we need to look at our building patterns when we are building. First, you need to make provision. You have to think ahead of time, make provision that the place can be aerated very well. Windows should be able to open and so on. There's nowhere, I believe, you close all the windows perpetually. The place has to be open, and so that there will be circulation. That is my opinion. I think we cannot allow ACs to be working without any air circulating, because the air that will be circulating in the room is the same air that the air conditioning is. It is only taking, the air conditioning is taking the moisture out of the room, and then it is taking water out of your body and reducing the temperature of your body. And therefore, it is not advisable. And so it even comes to the effect that air conditioners can make you one very dehydrated in the room. So every 15 minutes, if you are in an air conditioning room, you need to be drinking water, otherwise you become dehydrated. You start having headaches and drowsiness and dizziness, okay? So I do not support air conditioning, because if there are droplets, it could remain in there. But if the place is well ventilated, it's better. So there should be re-engineering if there's no way that one could be done, and then make that make it available so that the place will be well aerated.
Thank you, Doc. There is a question. All right, this one actually looks like a proposal from Edward Osafwado, and most likely he wants your take on it. He is strongly suggesting that crèche and kindergarten 2 pupils are asked to stay home for about a month. And he's saying this because of the fact that these groups find it difficult to wear the masks. So, as I said, most likely he wants your take on
He
this.
wants my take. My take is that looking at the moment, it will the time in which we are, it will be good for them to stay at home. But parents will have to go to work. So it means that there should be policies that will favor mothers or other parents so that they can stay at home with their children, or they should make other alternative arrangements. Okay. Apart from that, we can spend little time at the crèche, and then we go for the children. They shouldn't keep them for too long. Mothers who work from home can decide on when they will send their children to the school, and they should agree with the proprietors in the school. You see, if a mother is working from home, because I know some of the banks and so on, sometimes they work from home. And if your workplace, you can work from home, then you can organize yourself in such a way that you can attend the crèche. Otherwise, the children should stay at home. I don't have the authority. I think the education authorities can look at that. For me, they should stay at home. But there are other factors we have to take into consideration. Thank you.
Thank you, Doc. There is another question from Emmanuel Aqua. It says, please, in the case of the shift system, is it advisable for the same teacher to run the shift from morning to afternoon? So in the case of a shift system where they are running morning and afternoon shifts, is it advisable for a single teacher to handle both shifts?
I think it is not advisable, because tiredness will set in, and he may not be able to deliver. So I think teachers should be made available, but it shouldn't be the same teacher handling. After 8 hours, I think the labor laws and things will come in, and unless the teacher can do that, but it is not advisable. The teacher may not be able to perform at his best.
All right. There is another one from Lilia, and she is asking, is it right to call COVID-19 a rich people sickness, as currently people have coined it? Says, is it right that we call COVID-19 a rich people sickness?
Thank you for this question. In fact, it comes, our managing directors, our heads of institutions are contracting this disease. I don't think it's because they are rich. Maybe some of them want to travel and so on and so forth, yes. But what they lack is that there is no one who is shepherding them and looking for what they are doing. I know of someone, he has an assistant always who is going with him. When he touches here, he has this hand sanitizer and everything, so that he makes sure that when the man reaches the protocols, he makes sure that he sanitizes him and so on. And the big man is humble enough to accept those corrections. We are not looking at what our bosses are doing. They don't have anyone who is helping them. Boss, hand sanitizer. Boss, your mask, it is dropping. Correct it. And so on and so forth. Then, are you with me?
Yes,
then, yes. Then there are some of them who deliberately flout the COVID-19 protocol. You see, when there is a pandemic, we don't do things as usual. When you are a rich man, you have to travel, you have to sit down and assess the situation and ask yourself, is this travel very important? Can I postpone it? And so on and so forth. It is very easy, you see, in the plane, since you are up there, you cannot open the windows of the plane and ask for fresh air. So there's limitation. And so if we understand the situation on the ground, we are likely to make some of the decisions which will help us to stay alive. And there are some, when even they are not supposed to go out, they want to go out, you see, and they are found caught up in some of these things, outing to programs and so on and so forth. Sometimes they cannot also say no. They are invited to the program and they cannot say no. But this is the time to find a way of saying that COVID-19 is around. I do not want to break the protocol. So please spare me for that. So there are different things. It is not a rich man's disease. It is only killing the rich men because they are stressed up. Sometimes some of them, their immune system is very low. And so when they break the protocols and the disease gets them, they go very fast. You know, stress also reduces the immunity, you see. So, and we also had children also dying. We've had poor people also dying. So it is not a rich man disease. It is everyone's disease. And we have to work together to fight it. So I don't agree with him that it is the rich man's disease. Only that the rich men are not sometimes following the COVID-19 rules. And for that matter, they are caught in the web. And it also comes to those who organize programs. Please, do not organize programs and invite too many people, especially at this time when we have COVID-19. And also, when you are in your home and you receive visitors, please, because you have received a visitor, at the front of your gate, you write there, no mask, no entry. And when the person enters your house, make sure that you mask up so that you don't let down your guard. So I don't think it is a rich man's disease. It is a disease that is capable of affecting anybody.
Thank you. There is one from, okay, the name didn't appear. It says, are private clinics equipped to handle COVID-19 cases? In cases where the government hospitals and isolation centers are unavailable.
Yes, private clinics are supposed to put measures in place to handle COVID-19. Anytime they run into such difficulties of being overwhelmed with cases, they should liaise with the district authorities so that they can help them out. They can sit down and think about what they can do. The district assembly is there. They are actually to be championing this fight. They should be championing the fight and then supporting the health authorities to find solutions to it. If a private clinic is overwhelmed and there is a possibility of talking to someone to get a place where the people can be quarantined or treated, that is good. We were using hotels. We were using camping grounds and so on and so forth. So it is possible to handle all these things. But the private clinics are supposed to make arrangements to hold people and then possibly treat people whilst the COVID-19 is going on. In fact, the district health directorates share messages and then the policies and so on with the private clinics. If they haven't received, that means they have to contact the district office.
Thank you. Somebody is also asking who is monitoring the health centers. And I think here he's asking about the testing centers. This person says he went to a testing center on Friday. That's a general hospital for COVID-19 testing. And his check there showed the place was not operating. And I don't know how.
Tema General Hospital. I don't think that place,
general hospital.
Tema General Hospital is not a testing center.
It says
they can take your specimen and then send it to the testing center to be tested. That's what they do. There are about 22 testing centers in the whole country, and they are available with their numbers and so on. But what we do is we can take the specimen and send it for testing and then get the person to come back. So if the person goes and he gets there and there's nobody, I think there are phone numbers which have been displayed there so that they can call somebody to come. So he can still go back and check, and they will attend to him because all those protocols are there to be followed.
Thank you, Doc. There is a question from Nana Sechi, and he's asking, is there any immediate action or first aid in terms of drugs one can take when you hear maybe your relative or a kid has been exposed or tested positive? So is there any immediate action or drug you can take should one hear they or their kids have been exposed?
What we do is, when your kid has been exposed, that means the kid has become a contact. And if the kid has a good immunity, you have to observe that kid for 14 days. When you report to the health authorities, they will mount surveillance on the kid, and they will be calling to find out if the kid has developed any symptoms. If after the 14 days he has not developed any symptoms, then it means that there's nothing. If he develops symptoms within the 14 days, then you have to report back so that they can test and then find out whether it is COVID-19. It could be another disease which is setting in. So it is about communication and knowing where to call and so on. And we don't go too far away. It is the health facility around you. They can facilitate for you to reach the health authorities, especially the district health authorities, so that they can help. So it is about monitoring, to make sure that the child does not develop, when the child develops symptoms within the 14 days, then they can take.
Yeah, Doc, what I wanted to find out is that, yeah, but when the person has been exposed, do you wait till the person develops, the symptoms? You've heard that the child has been exposed. You sit and wait till the person develops symptoms. Can't anything be done? I don't know, such that even if the person will develop symptoms, then they are milder.
The child should eat well. The child should take vitamins to boost the immune system, and then observe. Because you cannot, apart from maybe vaccine and so on, which we do not have yet, there is nothing you can do. You have to wait, observing, and then reporting quickly. If the symptoms develop, sometimes the children, their disease could be mild. Some of them, theirs also can be serious. But in the circumstance, you have to make sure that the child is eating well, sleeping well, and you are observing to report any symptoms. The symptom is what? Fever, cough, and you have the health authorities there. Otherwise, you'll be wasting a lot of money trying to do nothing, because there is no treatment for this particular virus at the moment. All that is there is what people are proposing, and then what we need to use what the Food and Drugs Authority has proposed. But unless the person shows symptoms, you cannot say it is COVID. You cannot test. And when the person is exposed and you test, and it is not reached that stage for you to detect, you cannot detect it. So it is about waiting within the incubation period. I'm sorry, that is my opinion, actually.
Thank you, Doc. There's also another one here asking if there is any truth to the hydrogen peroxide story. Anything we can be doing daily. Yeah,
what
so
you can be doing,
it's on the hydrogen peroxide.
The hydrogen peroxide, the Ghana Medical Association has come out, and I think this thing is in the public domain. But if the Food and Drugs Authority comes out that it is okay, then we can go ahead. That one, I have nothing to say at the moment. But the GMA has come out clearly that they do not support it until the Food and Drugs Authority comes out.
All right, thank you, Doc. For the hydrogen peroxide, I think it's also very instructive. We all know that in itself does not treat COVID-19. And I'm sure, the publishers of the hydrogen peroxide who are even advocating for the use were not in a way suggesting that it can be used to treat. Because as we all know, it's a gaggle. And
yes,
it doesn't actually influence, it doesn't influence the lungs in any way. So for a person who has contracted COVID-19, there's no time to actually depend on hydrogen peroxide. But as a daily antiseptic gargle, I think what they have, even GMA, Ghana Medical Association, has actually supported is that it can be used for your normal daily antiseptic use, which
yes, but not for treatment. Yes.
Exactly. So it should be clear that it's not for treatment.
It's not for treatment.
Maybe as a preventive measure or something.
Yeah.
As Doc rightly said, I'm sure Food and Drugs Board would also maybe add their voice later.
Yes.
My clarity. At this point, I think we've exhausted almost all the questions here. I don't know if anybody has, it's 3:49. If anyone has any question which hasn't actually been delivered, I think the floor is still open. Otherwise, we'll be wrapping up very soon.
Yes. I have a question, and this actually is an area that I've been a bit worried about: microphones and churches. What's the general opinion on it? I feel it's a spreading agent, but we seem to turn a blind eye to it. I see almost everybody who is talking, in churches or in.
About what?
I think he was talking on microphone, the use of microphones at churches.
Oh, the use of microphone. Okay. The use of microphone. Hello.
Yeah.
Can I? The use of microphone is very, very, very important. Like I said, there should be somebody dedicated to be watching the microphone. One, when it is used and it is going to change hands, then they need to sanitize it. Or we should have many microphones so that people who are leading can have their own microphone. You keep your microphone, we finish, you hand it in, it is sanitized. But before you pick a microphone, sanitize it, sanitize your hands before using it. There should be somebody dedicated to be looking at how these things happen. Otherwise, they should have each person having his own microphone. And that one too may not work for certain churches because the whole church has one or two. But churches looking at the situation are improving on their COVID-19 protocols, and the microphone is one of it. When you go to our churches now, I can assure you that most of them are doing very well with the COVID-19 protocols. And they even need people to come and observe and tell them how they can better do it. So let us sanitize the microphone with hand sanitizers, and then we can use them.
Thank you.
Hello?
Yes.
Hello?
Yes.
Hello? Yes. Doc, what about people, especially Christians, who have the view that if you are filled with the Holy Spirit, you cannot contract COVID-19? What is your view on that?
That is ignorance. That is
so far,
ignorance. Even my pastor was telling the church the other time that, look, it is ignorance for you to come and stand there and say that, as for me, the Holy Spirit is in me, and so nothing can, because that's what Christ said. Christ never said that. We are supposed to follow rules. If you're a good Christian, you should have to follow rules. Because it is God who establishes governments. And once he has established the government, we are supposed to follow the rules and do what you have been asked to do. So those who are saying that one is complete ignorance, my brother.
Yes, it's happening. You join Trotro, you see gentlemen and women talking on top of their voice on their phone. When you confront them, put on your mask, they tell you all kinds of things.
Wait. It looks like the net is unstable.
Yes.
It is getting tired.
Yeah, I can hear you. You can talk.
Oh, okay. You see, when you join Trotro, you see, the time has come for us to make certain decisions to send good message to the Trotro. If the Trotro man does not get any passenger, because he's not putting on even a mask in the Trotro, nobody will climb, nobody will board the Trotro. And the Trotro driver, with all these things we are saying, should be able to tell somebody that, hey, put on your mask before you enter my Trotro. And some of the Trotro people were even giving water for washing hands and so on and so forth. Some drivers were doing that. Even some taxi drivers were doing that. Why have they stopped? So the Trotro drivers should help us to make sure that when we board the Trotro, we put on our mask. Because in the Trotro, the social distancing is poor. It is only the mask that can help us. The social distancing is very poor. It is only the mask that can help us so that we do not contract this. So everybody, in fact, everybody should be involved in this fight. And we ourselves should be able to ask the Trotro man, why did you allow this person to enter the Trotro without mask? That is where we have reached now. If he doesn't give you any good reason, oh, my brother, do you want to jeopardize your listening? You can get down. Another Trotro will come, who everybody in it will be masked.
I think the time is 3:56, and we'll be wrapping up shortly. Somebody wanted clarity on the hydrogen.
Can you please help me to ask a question?
All right, then you can please put it across. Hello?
Yes, speak, please.
Somebody wanted a clarification on the hydrogen peroxide. And he said during the submission, his line was breaking. What I said earlier is the hydrogen peroxide is not for treatment of the COVID-19. At best could be a preventive measure because it's an antiseptic. But once you contract the COVID-19, I mean, the role of the hydrogen peroxide actually is negligible. So that was the submission. So I think at this point, we have exhausted all our questions.
I think somebody wanted to ask a question.
Yeah, so he came on and I was actually giving him the platform, but I don't know whether, so if the person is still hearing me, you can put your question across, please. All right, in the absence of that, I think we would have to wrap up. Today has been a very insightful and educative.
Hello, officer. Hello, officer. I wanted to ask a question.
All right,
hello.
Please go ahead. Go ahead, please.
My question is, if one is contracted COVID-19 and is given the azithromycin after taking it and still tested positive, what must he do again? Because I learned if after taking it, you cannot continue taking it again.
He should go back to his doctor. He should go back to the doctor for further
directive or something.
Directives, yes.
Thank you. Yeah, so I hope we have all put across our questions because
I heard the voice of a lady who was trying to ask questions.
All right, then let's give her the platform. Please, the platform is open. There was a lady who wanted to ask a question. Please, you can do that. All right.
My question was about the cases. It looks like Europe and other so-called rich countries are getting it more than Ghana and other African poor countries. What contributes to that?
I think it is about the variant of the virus that we are dealing with. The virus keeps mutating. And when the virus mutates, I understand this particular one from for Europe, it mutates so fast that its way of spreading is very, very, very fast. So for the UK, I understand there is the B117 variant. It has 17 mutations, including several in the spike protein. And one of them is the N501Y. It has been found to help the virus bind more tightly to the ACE cellular receptors. And so it is making its virulence more and spreads very quickly. So it is because of the mutation and its transmissibility. That is why it is spreading rapidly throughout the nation. And so they had to do a lockdown on international travels so that they can stop the transmission. And also in Europe, it is very easy for it to spread because of transport. How long does it take even the COVID-19 to reach somewhere. You take, for instance, from Britain to Accra, it's about 6 hours, and it is here. And planes are coming and going every day. And once they are moving to all parts of the world, it is spreading very quickly. And because of the mutation, that is why it is spreading. Many variants are coming. And I read something somewhere, and it was saying that the UK one is corresponding with what we have here. I don't know how far it is true, but that is what I read this morning. So it is about mutations and the variants which are coming out. And as they come out, their ability to spread quickly is enhanced. That is what I think is causing the spread in Europe. And also the temperature at the moment is also very cold, and it facilitates flu and all those others. So.
All right, thank you, Doc. This will be our last question, but you can still keep your questions coming. We'll pile them and find an appropriate time to address it. As we know, this is a monthly series. So hopefully there will be another platform where we can address all your questions. This is Raphal Medical Centre, and we want to use this period to just introduce some of our services to you. Now, Raphal Medical Centre, we offer a 24-hour service, 7 days a week, medical care to our clients. We have specialist consultation days. Now we have a visiting pediatrician who offer pediatric services on Monday and Thursdays. So if you want to see a pediatrician, you can actually access it on Monday and Thursday at 2 p.m. We also have a physician specialist who consults on Tuesdays at 2 p.m. Physician specialist on Tuesdays at 2 p.m. There is also an eye specialist who consults on Tuesdays at 2 p.m. Now we have a general surgeon that's for surgical consultation. We have it on Tuesday at 11 a.m. and Friday at 7 a.m. Now for dental services, we have a dental clinic running currently. From Monday to Friday, it's on 2 to 5 p.m. That's during the week. We have it in the afternoon from 2 to 5 p.m. Then on Saturday, that's during the weekend, you can access the dental clinic in the morning. That's 8 a.m. For obstetrician and gynecological services, that's OBS and Gyne. You can access that one on Wednesdays and Thursdays at 8 a.m. in the morning. For orthopedic services, that's relating to bone, that's on Thursday at 8 a.m. We have a dermatologist who also consults on Friday, 2 p.m. Then when it comes to urological services, we have a urologist who consults on Saturday at 8 a.m. Now to summarize this, what this means is we have all the specialties available at our center. If any of these days and time are a little confusing, you can just call in the hospital and we would assist you with the days and the time. We also do telemedicine, especially in this COVID pandemic, where we are trying to limit exposure. So I'm sure for most of our clients, our telemedicine lines have been sent to your mailboxes or even as text message to you. You could also access medical services via that platform. Now, in terms of general services, currently we do all the routine labs and blood chemistries. We have a functional X-ray machine. We do ultrasound scanning. We have a new Doppler scanning machine. So for all your Doppler scanning, you can access it at Raphal Medical Centre. So in brief, that is Raphal Medical Centre, and we are here to provide quality healthcare service to our clients. At this juncture, I will hand over the platform back to our resource personnel to give us final closing remark. Then we'll bring this section to a close. So Dr. Yabani,
Yes.
you can take it over from me.
Yeah, I want to thank everyone. I want to say that COVID-19 is real. We shouldn't deceive ourselves, and we shouldn't deceive ourselves that it's not there. People are dying, even they are dying more than previously. We need to change, have an attitude. We need to have an attitudinal change to this time, and then take our lives into our own hands, and then be each other's keeper. Make the right choices because you have heard a good message today so that you can remain alive. We need a human resource to develop this country. You cannot be careless and lose your life because we have come very far. I want to thank the management of Raphal Medical Centre for the opportunity. And I want to thank you also listening to me and asking questions. God bless all of you, and may we stay safe and make the right choices. Thank you very much.
Thank you, Doc. So this brings us to the end of today's discussion. Our next meeting will be communicated to you via text or email. So thank you all, and God bless us all. Bye.
Bye. Thank you, Doc.
Dr. Yabani, thank you.
Thank you also. Thank you. Thank you for the opportunity.